A simple infection can become a silent killer in a matter of hours. What begins as a fever, cough, or minor wound can rapidly spiral into organ failure if the body's immune response turns against itself. Sepsis strikes unexpectedly, progresses aggressively, and demands urgent action to prevent devastating and often fatal consequences. Before I continue, please give this video a thumbs up and share it with your friends, so more people can discover this content. Also, subscribe to receive more content like this. Sepsis is a life-threatening medical emergency that occurs when the body's response to an infection becomes overactive and begins to damage its own tissues and organs. Rather than being caused directly by a specific germ, sepsis results from the body's overwhelming and uncontrolled immune reaction to infection. It can progress rapidly and without prompt treatment may lead to organ failure, septic shock, and death. Because early recognition and intervention dramatically improve survival, understanding sepsis is essential for both healthcare professionals and the general public. Under normal circumstances, the immune system responds to infection in a targeted and controlled manner. White blood cells identify invading microorganisms, inflammation is localized to the affected area, and healing begins once the threat is neutralized. In sepsis, however, this response becomes exaggerated and systemic. Inflammatory chemicals are released into the bloodstream on a large scale, leading to widespread inflammation throughout the body. This systemic inflammation disrupts normal blood flow and damages blood vessels. As circulation becomes impaired, vital organs such as the kidneys, lungs, heart, and brain may not receive enough oxygen and nutrients. Blood pressure can drop dangerously low, a condition known as septic shock. When organ function deteriorates as a result of this process, the risk of death increases significantly. Sepsis can arise from virtually any infection. Common sources include pneumonia, lung infections, urinary tract infections, abdominal infections, and skin or wound infections. Although bacteria are the most frequent cause, viruses and fungi can also trigger the condition. Even infections that initially appear minor can escalate into sepsis if the immune response becomes uncontrolled. Certain individuals are at higher risk. These include older adults, infants, people with weakened immune systems, individuals with chronic illnesses such as diabetes or kidney disease, and those recovering from surgery. Hospitalized patients, particularly those with intravenous lines, catheters, or ventilators, are also more vulnerable. The symptoms of sepsis can be subtle at first, but often worsen rapidly. Common warning signs include fever or abnormally low body temperature, rapid heart rate, rapid breathing, confusion or disorientation, extreme fatigue, and reduced urine output. Some individuals may experience severe pain, shortness of breath, or pale, clammy skin. Because symptoms can overlap with other conditions, sepsis is sometimes difficult to recognize in its early stages. A key warning sign is a sudden deterioration in someone who already has an infection. If a person appears significantly worse, confused, or struggling to breathe, urgent medical attention is required. Sepsis is a medical emergency that requires immediate treatment. Management typically includes prompt administration of intravenous antibiotics, fluid resuscitation to stabilize blood pressure, oxygen therapy, and close monitoring in a hospital setting. In severe cases, patients may require intensive care support, including mechanical ventilation or medications to maintain blood pressure. Prevention focuses on reducing the risk of infection through vaccination, proper wound care, hand hygiene, and early treatment of infections. Awareness is equally important. Recognizing the signs of sepsis and seeking immediate care can save lives. If you found this information helpful, please like and share it so more people can learn the warning signs of sepsis. Awareness truly saves lives. Don't forget to subscribe for more clear, practical health insights and leave a comment below with your thoughts or questions. I'd love to hear from you.